Hello, so this is the Fundamentals of Case Management Practice, Skills for Human Services, 5th edition. Chapter 20, Developing a Service Plan at the Case Management Unit. The Service Plan. You as the case manager do not give the actual service or treatment. Service or treatment is given at a provider agency. You develop the general goals the provider agency is to address. Some goals are treatment goals, treatment for mental illness, drug or alcohol abuse, or emotional problems. Some goals will be service goals, welfare assistance, in-home care, transportation, educational, and occupational goals. The goals are general for the provider agency to address in detail with the client. A good service or treatment plan should identify goals and employ client strengths to meet those goals. Involving the client and the family. Clients and their family. If the client gives permission, should participate in developing a plan for the client. With children, families should always be involved. With substance abuse, family participation can keep families together. It is important to listen to what the client wants as a result of services from your agency. Agency support for families to stay involved with clients is important in many cases. Using the assessment. The evaluation or social history tells you what clients' major problems are, what areas in their life need attention. The assessment should include clients' expectations and desires. Identifying client strengths. In looking for client strengths and resources, look at community resources, churches, clubs, and school, religious and cultural beliefs, practices, and values that are supportive and comforting, interpersonal skills, special abilities and skills, what the person would choose to do as a preference. Use this particularly with children, activities done with the entire family, hobbies, recreational activities, people, groups, or pets that can give client support and comfort. Individualized planning. Case managers develop plans for the client that are specific to a particular client. No two plans should be exactly alike. Self-awareness should help case managers to know when they are treating all people in a certain category alike. For example, all older people, young girls, all mothers, and so forth. Barriers to understanding, part 1. Language. The client may not be communicating adequately with others because of a difference in primary language. The worker may not be able to communicate with the client because the worker does not speak the client's language. Culture. The client may be unable to negotiate an unfamiliar culture. The worker may not understand the client's culture or may be inclined to judge the client's culture by the worker's own cultural standards. Disability. The client may not be able to handle all the details of the plan. The worker may overestimate or underestimate the extent of the client's disability. Barriers to understanding, part 2. Lack of resources. The client may lack the resources to fully participate in the plan. Examples include transportation, clothing suitable for a job interview. The worker may see the client's poverty as a barrier to the plan or fail to take the lack of resources into account. Mental illness. The client may be unable to communicate clearly or follow through the plan. The worker may be afraid of the illness or may fail to understand how the illnesses affect the client's capabilities. Intellectual disabilities. The client may be unable to communicate clearly or follow through the plan. The worker may see the client as a child or may fail to understand how the disability affects the client's competence. So that's the last slide for this one. Thank you for listening.